Today we're going to do a move about connecting the pelvic floor and the pelvis with our ability to move our feet. So as we're getting more awareness of how we're moving our feet, it can feel like we're doing less motion with the feet. And while we do want to stay balanced on that tripod foot, we want the foot to be able to move through a full and healthy range, just with a little bit more consciousness than how we were maybe flinging ourselves around before. So we're going to go through this awesome exercise that looks really simple but is pretty challenging for that. So you're going to step about a foot away from the wall with having a wall on your side. Okay, and right now the wall is on the right side and I'm going to be standing on my left foot and I'm going to put my right thigh up onto the wall. So the thigh is parallel to the floor, right? So it's not too high and it's not too low, it's parallel to the floor. But the most important part here is that I'm not letting this hip, this right hip, hike up also. So this feels pretty normal for my body. But if I bring that right hip down so that my waistband is actually parallel, it uses completely different muscles and it's way harder, and this is where I want you to be. Okay, so make sure that you're not hiking the hip up, because otherwise you're just going to use all of these muscles instead of actually being able to recruit the side of your butt. So before we get started, I just want to show you the positions in the foot. So we're going to be moving into pronation, which is where you lose some of that arch in the foot, and supination, which is where you create more of an arch in the foot. Now, it's not ideal to be in too much of an arch or too little of an arch all the time, but we need to be able to move between one and the other in order to move efficiently and to walk efficiently. So that's what we're going to do. Thighs parallel, waistband is parallel. I'm even on my tripod foot to start on this left foot, meaning my weight is just perfectly balanced underneath the big toe, the baby toe, and the heel, okay? Then what I'm going to do is I'm going to push this thigh into the wall to rotate my hips open to the side. And what you'll feel that does on your foot is it creates a bigger arch, or it supinates your foot a little bit. And you're going to feel the outside of your left hip like really turning on. And then you're going to rotate your hips back forward and even a little bit back towards the wall, which is going to drop the arch of your foot, of this left leg. Okay, I'm cool with you holding on to the wall if that feels better, and we're going to do it again. You're going to rotate the hips open to the side, to the left, so away from the standing leg. Again, I'm not hiking up on that right side, it's staying down, and this creates a bigger arch in my foot. And then I'm going to rotate my hips towards the wall, and that takes the arch out of my foot. Again, press into the wall, open the hips out to the side, and hips towards the wall, rotating in on the foot. Okay, I'm going to show you from the other side so you can see from the back. All the same things apply. Okay, that left hip is pulled down. I'm centered on my tripod foot, all on my right foot. My chin is drawing back through my throat. And then you're going to press the thigh into the wall to open the hips up to the side. That's going to lift the standing leg arch a little bit. And then you're going to rotate the hips back towards the standing leg. And that's going to bring the arch down a little bit. Again, hips open to the side, pressing the thigh into the wall, getting a bigger arch in that foot, rotating towards the wall. Awesome. And one more time. I'm feeling so much work in the outside of my butt here, which is exactly where we want it. Getting this muscle and the pelvic floor stronger and more resilient and able to move well with our feet that move well. Enjoy.